Hello and welcome to the Superposition Guys podcast. My name is Yuval, and my guests today are Romana Schirhagl, co-founder, and Deepak Veeregowda, CEO of QTSense. QTSense develops quantum sensing technology using NV center sensors in nanodiamonds for biomedical applications. Romana explains how their technology measures magnetic noise from free radicals inside cells, indicating cellular stress, similar to small-scale MRI. Deepak discusses the company's product, Quantum Nova, which is available for research and diagnostic purposes, particularly in cancer and infectious diseases detection. QTSense describes their technology as having subcellular resolution and nanomolar sensitivity, sees a key advantage in applying NV sensors in living systems where sensors move and rotate, and aims to impact millions of patients by 2030. We hope you enjoyed this episode. Hello, Romana. Hello, Deepak. Thank you for joining me today.
Good afternoon. Thanks, Yuval. It's nice to be here.
So, Romana, who are you and what do you do?
My name is Romana Schirhagl, and I'm a professor in the University Medical Center in Groningen and also founder of QTSense, which is a startup from my research group. And basically, what we do there is that we have developed quantum sensing for biomedical applications. So, for everything in living cells, in tissues, in patient samples. And what the company is doing is to make that into products that we can bring to the market, bring in the clinic, to make it small, user-friendly, and the product.
And Deepak, who are you and what do you do?
So, this is Deepak, and my background is in engineering and science, specifically in mechanical engineering. And then I was trained to apply this knowledge into biomedical science. So I spent almost 10, 15 years doing this. As well, in the past couple of years, I worked extensively on entrepreneurship and taking these backgrounds. I co-founded the company with Romana, and I'm currently the CEO of the company, aiming at the growth and strategy for the business.
I believe you're using NV vacancy or NV center sensors. Is that correct? Could you explain for the audience how NV sensors work?
Yes, so basically it's like the what we measure is similar to a clinical MRI, but on a much, much smaller scale. And what in clinical MRI, these gigantic tubes and these field gradient tubes and these sensors, that these coils do that you have there, for us is done by this tiny point defect in the diamond. And what we do now in most of our measurements is that we shine a laser. That laser makes the diamonds bright, and then we wait how long it can remain bright. So we get a time, and that time is shortened if there is the presence of radicals or specific chemicals in the surrounding. And in our case, in the cell, those are free radicals. And the free radicals are an indicator that cells are under stress. So, for example, if we treat cells with a drug, a cancer drug, the cancer drug is poisonous, they are stressed, then you have a lot of radicals. Then this time that the NV center takes to go from bright to dark is shortened. And then we measure this time, and this gives us an indication for for the amount of magnetic signal that we have in that specific position. And since this sensor is very small and very local, we have very high spatial resolution and sensitivity. So we basically see everything that is within some nanometer from these small particles.
So just to connect the dots for me, you mentioned radicals, and then also you mentioned magnetic field. So how are they related?
So we measure magnetic noise. So a magnetic field is what you would have with a magnet, like your refrigerator magnet or something like that. We don't measure magnetic field in that way, but we measure very tiny magnets that are flipping around. And this flipping around is done by the radicals. So we basically measure these very small flipping magnetic fields from the radicals in the surrounding.
You mentioned that you look at cells. So how close does the sensor need to be to the cells, and how does it get there?
We actually bring these, so we use nanodiamonds and we actually bring them inside the cells. So they are very small and the cells engulf them. So cells, almost all mammalian cells more or less eat particles if they are in a specific size. To some extent, they take them up and then they are in the cells.
So you essentially have sort of diamond dust, so to speak, that gets into the cells.
Yeah.
Then you shine laser light on the cells, and then you wait to see how long before the dust fluorescence. Is that about right?
Yeah, so it fluoresces and we make it bright, and then we see how long it takes to get to the dark state.
One thing you follow that we basically shine the nanodiamonds, right? So our target is nanodiamonds. So we basically excite those nanodiamonds, and that's the fluorescence we monitor.
How so does that work on basically one would take a sample like a biopsy from a patient in the future, or is it done while the patient is there? How does it work clinically?
Yeah, so we have a few different applications, but how it usually goes is that we get samples from the clinic. Usually we work with rest material. So for instance, you can take a blood sample and then we put our diamonds in. So the patients give the blood and then we take the sample and then we do our measurement. So it's like an ex vivo measurement. So it's not in the living patient, but the in rest material. So when they do other diagnostics, they also usually take blood or as you mentioned, biopsies. We can also work with tissues. Yeah, so they take the sample from the patient and then we get the rest material and then we do our trials with those.
So the aim is to have some sort of an in vitro model that can capture some of the mechanisms in the body using the patient materials, as Romana explained. Yeah, so that's clinically where we think we can add more value.
And Deepak, NV sensors have been around for a while to do different things. How is your technology different than existing NV sensors?
Um, I'm not in depth with Envy to nanodiamonds. I think Romana can give some history about it. But one of the knowledge that I have gained in the past couple of months is it's not that a mature technology yet. There's been a lot of work going on in this domain. Single NV centers are there more stable, but has its own applications. But when you look at multiple NV centers, especially in an at nanoscale nano diamond, there are more complexities associated with it, and we are able to decipher that and apply it into a more complex biological systems. So about to be mature technology into a more complex biological systems is where we are playing. I think Romana, I think she can add a bit about history of NV centers on this.
Yeah, so technically one thing that is, I would say, the most striking difference is most people use bulk diamond and then in a very clean environment. And what we are doing is we use small particles that are in liquid, in living samples, and they are moving and turning, and we have to track them. So what most other people in the field do, they don't have to track, they just have yeah, a macroscopic diamond, and then the NV centers are there, and then they work with this. I mean, there's different technology that people do, but yeah, for us, what is really the main difference is that it's in a living system, swimming around, rotating.
And Deepak, I understand you recently raised some money from an investor. Could you tell me about that, please?
Yeah. So we raised in equity and non-dilutive as a team. Largely, when you talk about the non-dilutive, we have around 5.5 million at the moment. It's a consortium money, all aimed at improving um, our product. So at QT Sense, we have transformed this technology into a product. The platform is Quantum Nova, and this Quantum Nova platform is better made fit to its pharma and academic research as well as for clinical research. So there's this 5.5 million which would come across. It's going to empower our Quantum Nova discovery platform that's going to aim at cancer research, especially to add more value in medical oncology. Um, and we also have the other 500,000 we have raised through equity, right? And that's one of them is QDNLP. That's the VC firm in Amsterdam led by Tan, Chris, and others. We also have a business angel, bringing in some money in it as well.
Is the technology applicable to specific types of cells or specific types of materials, or do you think it's widely applicable in the biological sense?
Well, I would say it's very versatile. So my research group has also looked in very many different applications. So we have looked at basically the whole zoo that you might want. So all kinds of patient samples, yeast cells, worms, cancer cells, lung cells. Yeah, so it's quite versatile. There are some small adaptations depending on which exact application it is, but in principle, I would say the technology is very versatile.
How were you able to validate it, to convince that the results are real?
This is a complicated question. I mean, there are some things that you can do. For instance, if you have some expectations about what the biology should do, so you have um, some hypothesis, or you have in biology there are these inhibitors. So you basically shut off a certain process, or you turn on a certain process, and then you can see whether it actually does what you expect it to do. So that I would say is one thing. You can also make radicals in a somewhat controlled fashion in a tube, and then measure and more or less, I'm not calling it calibration, but you can estimate what concentration you get. So if you make more of these radicals, you should also have a more signal, so that you can do as well. You can I mean, the difficulties there lie in that our signal is very local. So this is something other technologies don't have that resolution. So sometimes if we compare with standard techniques, they measure different molecules on a different length scale, on a different time scale, and then often it's similar, but not necessarily always either, because we are so local, right? And so sometimes this is a bit difficult to really have hard proof, like if you have a greater resolution than what was there before. So I mean, we have a lot of data in a lot of cases that really make sense taken together, but if you have greater resolution, I mean, depends on how critical people are. As in, I mean, I think there are some people that would probably still say, "Are you really sure that's real?" Yeah.
If I may add to that, Yuful. So, for example, if the question is around um, in terms of applications, right? So you're trying to create a value. For example, Romana and her group have worked extensively on drug efficacy. There is this publication on piroxicam. It's a drug consumed to reduce oxidative stress in cases of osteoarthritis or rheumatoid arthritic cases. There is a clinical evidence that this drug has been prescribed for both the cases, but only in one case it works better, right? And they picked up this topic and using the technology, the quantum sensing in these cells and the fluid, they were able to explain the mechanism of action of this drug, right? And that basically kind of confirms that existing clinical evidence that why this drug works in one particular case far better than the other case between rheumatoid and arthritis. So basically we add value there, right? So that the second element is at the basics of at the fundamentals of its technology itself. We basically what we do is you can detect free radicals, and also it is responsive to change in the concentration of the free radicals, right? It's not only just detecting you have it or not inside the cell or around the cell, it's also the concentration of it. There are also some existing techniques that gives you some sort of an estimation, as Romana said. For example, there are fluorescent dyes that you use to get if you have these free radicals related to oxidative stress or not. If you have, what is the concentration change, and these dyes do show some changes. And they have their own disadvantages. They can't be real time. They're not sequential, and so on and so forth. So if based on that information as well, we could see that our technique complements it or even gives better information. So all I want to say is in terms of if the technology works or not, to get the confirmation, there are two ways. One, whatever is the mechanism of action that is available in pharma, we can back it up with our technology. There's certain evidence towards that. And with respect to existing techniques, comparative techniques, we complement and supplement information.
Maybe also to add, like we have some data from a blinded clinical trial, right? And that's also like very strong evidence. Like if you can link then your readout to some from a blinded study. So basically, if you do a blinded study, you get samples, but you don't know at the time what they are. So and in the end, after you have collected all your data for a year or something like that, then you unblind the study and then you find out. So you give your data and they give you the database of what the patients were, and then you basically combine the two. So at the time of measurement, nobody knows what you're measuring. So that is also, I think, a very, very powerful data and very cool moment if you see like that you get something then it really makes sense and still that stands this rigorous test and still looks what you would expect if things work the way you think.
You mentioned that you can measure the concentration of radicals. Can you also use this technology to identify which radical exists?
Not at this point. There are ways to do it. Like in principle, NV centers can measure anything that any magnetic resonance techniques can measure. So MRI, NMR, ESR. So there's a bunch of methods available in principle, and they all have an optical equivalent. But in the way we do it right now, we don't do it. We do now the very simplest pulsing sequence. So we basically get the sum of what is there. So it's equivalent to what you would do in a clinical MRI. So the signal we get is like that. But with the clinical MRI, you also only get, these gray images. So you get the specific, like a concentration. But you could also do NMR spectroscopy, for instance. Then you get more chemical information, or electron spin resonance. Then you would get more chemical information. But we are not doing it at the moment. It's more complicated.
In your estimation, how long before this technology is available on the market beyond the research that you're doing?
Yeah, okay, Deepak.
Okay, now I just wanted to add the it has took I was just looking into it like around 10-15 years of work from Romana Hunter Group, to pick this technology, polish this technology, and find the right applications for it. They have found a way to see how they could explain biological activity at subcellular level, at the cellular level, even in tissues and fluid samples. So the application is there, and what we have done in QT Sense is we took this technology, which is in advanced state compared to any other group, I would say, from Romana's group. Then we have already productized it, so one can buy this device on our from QT Sense at the moment. So our markets are in two phases. One in two segments. One market segment is in academic and pharma labs. If they want to understand mechanism of action, they want to do some fundamentals studies. If they want to develop a better in vitro model for their ADCs, the antibody drug conjugate interactions, anything that they want to do at phase 0 level, at R&D level, we have a product segment called as Quantum Nova Discovery. And we also have the second one, that is a Quantum Nova Diagnostics. So we are working extensively in terms of infectious disease. How can this technology solve some of these critical issues within the infectious disease? It could be early detection, it could be monitoring of those infections, especially in sepsis area. So Quantum Nova Diagnostics is the second product. So our technology is already being converted into these two products that one could buy out off our shelves in Quantum in QT Sense.
Give me a sense of numbers, please, in terms of resolution or sensitivity, or maybe in how this compares to existing methods.
So if you look at the sensitivity, we are somewhere in the nanomolar range. And if you look at spatial resolution, in principle, it's like that sensitivity decreases with distance to the power of 6. So the further you are away, it goes very quickly that you don't see anything if it's too far away. And what we know that it's roughly a few tenths of nanometer that until you cannot see anything at all anymore. But basically you have this dependency with R to the 6th, so the further away. So it's not like completely zero if you are further away, but it just goes very rapidly towards 0. And how does this compare to other methods? Well, in addition to that, we have we are looking at the particle, and we have some kind of precision to where this particle is. So, for example, if we attach this particle to a mitochondrion, then we know they are together, and then we know everything we see is really at this site. If we don't attach it to something specific and it just swims around, then we are limited by the resolution of how precisely we can tell where the sensor is. So if we know it is some tens of nanometer from the sensor, and then we have a bit less resolution depending on the movement as to determine where the sensor is exactly. So if we have some trick to determine the position, then we have higher precision on the location.
Largely subcellular resolution and a few nanomolars of concentration. We should be able to pick it up and draw some insights out of it.
Yeah, so we can, for instance, say, okay, in the mitochondria we have a certain response, and in this cytosol we have a different response. So we can, these substructures of the cell, we can say where is happening what.
Funding aside, in the past year, what was the most exciting moment that happened in your work?
Romana has more to say, I guess. Romana, you want to start, and then I will follow you after that.
But my most exciting, I mean, one thing that we are seeing now, so we are now running this trial on sepsis detection. And we have now some cases where we see that our detection method seems to be better than what the clinicians can do. And this is something that really motivates even more than the funding to see like, hey, we can really I mean, this would be people in the future we could save. And if this is something we can really do, I mean, this is like, this is like a huge motivation and super exciting for me. If something that we made can actually save somebody's brother, mother, kid, whatever, I mean, this is very, very exciting. So if we manage to do that, and it seems now that we are going in that direction, that it's really starting to be useful in the clinic, then this is, I think, by far my most exciting thing I could say.
Adding to that, we have an impact 2030 vision, so we think, with the work that we are doing in terms of the excitement Romana just shared, we can touch more than 1 million patients, by 2030, especially our quantum nova diagnostics is being aimed at that level, so that we have more to offer to the existing healthcare. So for me, to a question about excitement, there are two things. Especially one of the things I really got excited is how a diverse team like ours, right? We have guys from optical engineering, we have guys from applications who comes from, totally different science background. That they are more into spatial biology, and then you have guys um, from optics, a guy from software engineering, who learned everything from scratch up, being in the team. So how they bring all this knowledge, and then they create this wonderful product. We had our first product. It's a kind of a prototype still. The point we were able to ship it to our first customer at University Medical Center Groningen, and that was a good moment where everything comes in all the work people put in, to have that product in front of you. Although it's incomplete, but functionally it does everything, and that was good. And even better was when this device was, has been installed at in University Medical Center. There were some of those who were using earlier users of a similar device would come across and see the interface that we have built in with the device, and they said, "Wow, it's so easy to use this device now. It's I could make few clicks and I could get that." Those kind of results. So that's kind of excites. And a cherry on the top is really that free radical is such an important biomarker in the medical biology field, and many of them have not even thought about the value you can get out of mapping it at subcellular resolution. And when you were knocking on the doors and say, "Hey, is free radicals real time, non-destructive to cells? Something does it excites you guys?" And I see that just their eyes go blink, all the stars. Can you do this actually? And when these guys come back with that feedback that, yeah, well, this is a wonderful technique, they should have, it can create more value for us. So the demand that we are able to create with this wonderful a product like this is something that excites me particularly. Yeah.
And last hypothetical question: if you could have dinner with one of the diagnostics or biology greats, dead or alive, who would that person be?
So if you rephrase the question, Ufo, so you're talking about the experts in diagnostics, or
It's up to you. You're getting a ticket to a dinner, and you can invite whoever you want. Who would you invite to that dinner?
Interesting question. I mean, we're looking at where the quantum sense should, where we look at that we could aim at, in the market, and combination of technology and business wise, specifically in diagnostics. There are a couple of them, and I think one of them I would really love to do is guys who have developed a sepsis diagnostic tool. They're just a spin-off company not spin-off, let's say a startup company, so 10 years old right now, and they just started to create an impact, and it's a company in California working on sepsis diagnostics. So I would really like to have a dinner with them. What it took them, they're also saving lives. So sharing that experience would be great. That's what I would aim at. Yeah.
And Romana?
Oh, I don't know. I'm not. I don't really have that. I don't really think I have a wish to go to dinner with someone specific. I mean, maybe people from big pharma companies. I think there's also a lot of very interesting people. So picking one is very difficult. I mean, nowadays I really love to sit down with successful entrepreneurs and just quiz them forever. But it does go.
If I may add on her behalf, if I have to say that I think Romana would really love to go to dinner with one of those patients, who have been, whose life has been saved because of our technology, because of our device, so that you could diagnose the sepsis early and it saved them, whatever, that I think she's kind of that woman. She would go for dinner with those guys, happily sharing lunch dinner with them.
They don't have to
In
go to
fact,
dinner. They don't have to go to dinner with me. As long as they are alive, I'm happy.
say right.
Very good. So, Deepak, Romana, thank you so much for joining me today.
Yeah. Thanks a lot, Yuval. Thanks for having us here. Appreciate that.